I last class we have started the research with the what is research and some of the important points we are discussed based on the evidence based practice, and we are referring the basic book is the Polit. On that basis we are already discussed about the some of the important points of the research. Today we are going to discuss more detail about the research, some main points, then we'll come to know. Then after that, next section we'll discuss what is qualitative and quantitative. So first, already I think the most of the research or the studied person know these two terms. First one is the independent variable and another one is the dependable variable. Independent variable is nothing but it is a presumed cause is the independent variable, and the presumed effect is the dependable variable. The presumed cause is the independent variable, and the effect is the dependable variable. Or we can tell the dependable variable is the outcome variable or depend on variation in the independent variable. We can tell like that some of the person have habit of the smoking. Because of smoking, what effect will happen, that is the dependable variable, and here smoking is the independent variable. Otherwise we can take another example. Now we are in under the pandemic. The independent variable is nothing but we are not using mask properly, and then we are going to study if you won't wear the mask, what will happen, what is the result or what is the effect. There may be chance to high prevalence or there is a high chance of affect the corona-19. That is a dependable variable. So because of one cause, what result we will get if we study, that studying is the independent. Because of study, what will happen, we'll get more than 80%. That is the dependable variable. Here we can see one of the example, the patient pain. Pain is the dependable variable that depend upon the nursing action. Because of this nursing action, what changes will happen to the patient pain? So that changes is the dependable variable. Because of that change, which factor will be affect? That is the independent variable. Okay, so just one is the cause, and because of that cause what effect will happen, or we can tell some because of some nursing action what result will happen, or even we are studying the students because of teaching what result will get. The teaching is the independent, and that result, the knowledge is increased, the skill is increased, the practice is increased, that is the dependable variable. Okay, so this is a best example for the independent and dependable. This independent and dependable variable actually it is direction of the influence. Some of them things influence another factor, not exactly rather than this cause and effect. Of course, cause and effect is the one of the main factor of the independent and dependable variable. Independent is a cause and effect. Rather than that, the direction of influence, how one factor will be influence other, how teaching will be affect the knowledge. The teaching is the independent, and that outcome, the knowledge is increased, that is the dependable variable. I think you make clear. So next time is the conceptual definition. The present the abstract or theoretical meaning of concept being studied. Whenever we are commonly this term is we are using in the quantitative studies. Conceptual definition is the abstract or theoretical meaning of concept beings what we are going to study. That is the conceptual definition. The concept about the study, how the variable will be observed, how what are the things we are going to measure, what we are measuring exactly, what variable we are going to check. This everything will come under the conceptual definition, the concept of caring, concept to assess the anxiety, or a concept of some well-being, something. So what we are going to assess exactly, concept of to assess the health determination, anything. If we are taking in sociology, we can assess the uh, religious practices of some personalities. That concept in religion, we can go to in depth, that some of the very oral traditional practices, oral traditional caste system, oral traditional practice and the caste system. This all of them will come the conception. What we are going to assess, that basic concept. If suppose we are going to take one study about the that example, anxiety is a concept that define the term of physiological and psychological function. For researchers, choosing emphasize physiological aspect of anxiety in next time is the operational definition that we'll see later. Then we'll come to this example. Just kept in mind in one study, this is one example. Here anxiety they are going to study. In anxiety, the concept is a both physiological and psychological functioning. And next we are going to operation definition, that it's a Palmer sweet index. We'll see. So first kept in mind, what is conceptual definition? It is a meaning or abstract of the study, or what concept we are going to study, what we are going to study, or what variables we are going to measure, what things we are going to measure. Maybe we are measuring the anxiety of patient or personal hygiene of patient. Like in sociology students, they are going to study some caste system, some of the traditional folk something. Maybe we are going to study about the some specific personalities behavior, this everything what exactly going to assess, or what variable we are assessing, that is the conceptual definition. Operational definition. Operational definition is in that study, in that concept, how that concept we will be checking specifically. That is the operational efficiency. Last example we can take. We are going to check the anxiety in physiological and psychological process. That is a concept. That anxiety, one patient or one number of patients, anxiety we are going to examine. That is the concept of study. How will examine that anxiety? That will be defined the operational definition with the use of Palmer sweat index. Or we can tell another example. We are going to assess the some health determinants of the some communities. We can take any community, health determinants of the slum people. Okay, there is a multiple factor will come in health determinants. If you are checking, we can see more than 10 to 12 factors. In that, we'll take only one. We are supposed to take the family, or we'll take the income, or we'll take the education status or socio-economical. That particularly what will be exam. Even in socio-economical also, suppose I told determination, we'll check the determination, health determinants of the one community. In that community we'll go to check the socio-economical. Then in that socio-economical, how will be assess that socio-economical? We can use Kuppaswamy's that classification. That specification is the operational definition. How one concept will be specifically defined or explained, or how one variable will be examined specifically, that is the operational definition. Won't be confused that time. One is a conceptual definition and another one is the operational definition.